Yeah, good morning to all the third year comedy students. So this is Dr. Sunil Kumar. So today I would like to discuss about Unit 3, which is very important. So it is nothing but chemotherapy, that is the use of antibiotics. So in comparison to the first two units, what we discussed, that is about cardiovascular drugs as well as diuretics, these the drugs which we call it as chemotherapeutic agents or antibiotics, they are much regularly used when compared to drugs which are used as diuretics or which are used in cardiovascular problems, because nowadays we are seeing individuals suffering from many infections. Okay, so in most of the infections doctors will prescribe antibiotics, and that's why these drugs are very common in the present scenario. That's why you should have a thorough understanding regarding the usage of antibiotics, because what I feel that without proper I need to say that uh, without knowing the proper causative organism, so at present, many physicians are prescribing antibiotics blindly, okay, and that is causing a lot of problem. One of the major problem is a resistance and superinfection. Okay, the antibiotic which used to work very effectively, when you use continuously for a certain period, that antibiotics becomes ineffective. Means microorganisms will gain resistance to that antibiotic. Then you have to change, switch over to another antibiotic. So such kind of problems have been encountered and has become a common regarding antibiotics. It is very essential to have a thorough knowledge regarding antibiotic. So with this short note, I would like to share a screen. Yeah, I hope students this is quite visible to everyone. Yeah. So this is your topic of today's discussion, that is chemotherapy. Okay. So let me come to the objective, because as a general practice, we have to define the objective. Then we have to switch over to the topic. So what is the objective of understanding chemotherapy, or just a minute, sorry. What is the objective of understanding chemotherapy? So chemotherapy, the main objective to understand chemotherapy is to have a detailed knowledge, is to have a detailed knowledge of pharmacology of chemotherapeutic agents. Okay, the main objective is to understand the pharmacology, means what is the mechanism of action of particular antibiotic, what is the classification of particular antibiotic. So what are the adverse effects of that particular antibiotic? What is the spectrum of that particular antibiotic? So what are the therapeutic uses of that particular antibiotic? What is the drug interactions associated with that antibiotic? So we have to go for entire discussion. Okay. So to gain a detailed knowledge of pharmacology of chemotherapeutic agents and their role in treatment of various infections. This is also very important. So what is the role in the treatment of various infections? So what kind of antibiotics has to be instilled? Whether we have to use in combination of, whether we have to use combination of antibiotics. If we have to use combination of antibiotics, where we have to use the combination, and what kind of combinations are used. Let me give an example. You take TB, tuberculosis. Okay, it is caused by Mycobacterium tuberculosis, TB bacteria. And here the bacteria is very strong. It creates a cassation. It constructs a wall around it, and a single drug cannot break the cassation, and it cannot kill the bacteria or inhibit the bacteria. That's why we have to use 3 to 4 drugs in combination in order to break that wall. Am I right? Break that cassation. So, for example, we are using isoniazid, rifampicin, pyrazinamide, or isoniazid, rifampicin, streptomycin, isoniazid, rifampicin, ethambutol. Okay. So, such kind of combinations are preferable. Okay. Not only in that, even penicillin is sometimes used with streptomycin. Okay, in case of subacute bacterial endocarditis, okay, which is a severe inflammation of your heart, layer of the heart, endocardium layer of the heart. There, penicillin is used along with streptomycin. So that I will justify, and I will discuss in detail when I come to individual antibiotic. So first today, let's discuss the basics of chemotherapy. Okay. So I have shared a cutting of my notes. I hope this is visible. So this is chemotherapeutic agents and their applications. Okay. So first, let's define chemotherapy. We will go for chemotherapy. What are chemotherapeutic agents? That we will define later. First, what is chemotherapy? Chemotherapy, if you observe carefully, it is defined as use of chemical compounds in the treatment of infectious diseases. Use of chemical compounds or use of chemical substances used in the treatment of infectious diseases so as to inhibit or kill the infecting microorganism without damaging the host tissue. Means that particular chemical agent which is used in the treatment of infectious disease, it has to inhibit. Inhibit means what? Inhibit means the bacteria is not allowed to multiply further. Okay, that is called bacteriostasis. Means bacteria will not be allowed to multiply further. So when the bacteria or any microorganism fails to multiply, its count remains less, and when it counts remains low, so definitely your immune system will take care of that. Am I right? Okay, because immune system will dominate when the bacterial count is, when the microorganism count is very low. Okay, but when the microorganism count will suddenly increase to an abnormal level, then that will dominate your immune system, that will suppress your immune system, and you will be exposed to wide variety of infections. Symptoms will begin. Okay, so here it is chemotherapy is defined as the use of chemical compounds in the treatment of infectious disease so as to inhibit, means suppressing the multiplication of that microorganism, or completely kill the microorganism, completely destroy the infectious microorganism. Two things: one, you can inhibit the multiplication, keep the microorganism level in low count so that it will not further survive. Immune system will take care of that. Or you completely kill the microorganism. Okay, so both the works will be done by antibiotics. And most important thing is without damaging the host tissue. Means it should, the antibiotic or chemotherapeutic agent should be effective only on the microbial cell or on the infectious microorganism. Am I right? It should not disturb the host tissue. It should not damage our host tissue. Okay. For example, let me quote some quite a simple example here. See, ethanol, hydrogen peroxide, many types of poisons, when you swallow, they will also kill microorganisms. But along with killing microorganisms, they will also kill our cells. They will also destroy host tissue. Okay, that should not happen. That is the difference between consumption of ethanol or any toxic substance and antibiotic. Antibiotic is only effective on the, it will only destroy the microorganism. Okay, it is not going to damage the host tissue of human cell. Am I right? So that is the definition. So let me repeat. Chemotherapy is defined as use of chemical compounds in the treatment of infectious disease so as to inhibit or kill the infecting microorganism. Inhibition means stop the multiplication or completely destroy the infecting organism without damaging the host tissue, without damaging the human tissues. Okay, so that is about the definition of chemotherapy. Okay, if you feel that this is quite complicated, you can make it more simple. So chemotherapy is defined as use of chemical compounds in the treatment of infectious disease. Even that will be sufficient. Okay, chemotherapy is defined as use of chemical compounds or chemical substances in the treatment of infectious diseases. Even you can write down that much. But if you write this complete definition, so definitely the expected marks will be achieved. You will get the expected marks. Okay, yeah, that is one thing. So coming to the next aspect, yeah, you can see here the branches of chemotherapy. Chemotherapy is further divided into two parts. One is called as antibiotics and another one is chemotherapeutic agents. Antibiotics and chemotherapeutic agents. Okay. So what is the difference? What is the difference between an antibiotic and a chemotherapeutic agent? Let's discuss. Antibiotics means, please try to understand, when I use the word antibiotic, you should understand that they will be synthesized or they will be produced by microorganisms. Okay, that's why here I have mentioned antibiotics are agents produced by microorganisms. Produced by microorganisms. For example, penicillin is an antibiotic. Okay, it is obtained from, yeah, Penicillium notatum, Penicillium chrysogenum. Okay, so tetracycline is an antibiotic. Tetracycline is obtained from Streptomyces aureofacial or Streptomyces remosus. Okay, like that. Antibiotic means it should be obtained, it must be obtained from microorganisms. Okay, antibiotics are agents produced by microorganisms which suppress the growth, means which will stop the growth or kill the microorganism at very low concentration. This is very, very important point. Which will suppress the growth or which will kill the microorganism at very low concentration, at very less concentration, it has to damage. Okay, so antibiotics are agents produced by microorganisms, first point. Next, it will suppress the growth or kill other microorganisms. Okay, so for example, penicillin is obtained from fungus, but it is used to kill many bacteria, many type of gram-positive bacteria. So that's why antibiotics are agents produced by microorganisms which suppress the growth or kill other microorganisms at very low concentration. Means at very low concentration, it has to kill the microorganism without affecting the host tissue, without damaging the host tissue. Okay, that's why I have even given an example to make the things clear. Antibodies, many antibodies here, including ethanol, lactic acid, here you can see, and hydrogen peroxide. So many antibodies, ethanol, lactic acid and hydrogen peroxide, they will also inhibit the microorganism. You can see here, they will also inhibit the microorganism, but at higher concentration. Okay. So even if you use lactic acid, hydrogen peroxide or ethanol or antibodies, they will also kill the microorganism. Then why should we need antibiotics? The main difference is antibiotics kill the microorganisms or suppress the microorganisms at a very low concentration without damaging the host tissue. Okay, it will not damage our tissues. But if you consume antibodies, ethanol, lactic acid and hydrogen peroxide, so definitely they will, I mean to say that they will also kill the microorganisms or suppress the growth of microorganisms, but at higher concentration. At low concentration, they can't kill microorganisms. And when at higher concentration, they kills microorganism, definitely that higher concentration is also very, very dangerous to the host tissue. Even our cells will be damaged. Okay. Yeah. So now examples of antibiotics which I mentioned, which has to be produced from microorganism, which has to be produced from microorganisms, such as penicillin is a wonderful antibiotic, streptomycin is another antibiotic, and tetracycline is another antibiotic. You can see here penicillin, streptomycin and tetracycline. Okay, these are antibiotics. Then what is chemotherapeutic agent? Chemotherapeutic agent is a broader term. Okay, antibiotics includes those drugs which are obtained from microorganisms. Chemotherapeutic agents is a broader term which includes drugs which are obtained from microorganism like antibiotics, and drugs which are synthesized in the laboratory. For example, sulfonamides, metronidazole, isoniazid. These drugs are synthesized in the laboratory, and they will also suppress the growth or inhibit or kill the microorganisms. Okay, but they are not antibiotics. Please try to understand. They are synthetic compounds. Okay, got it. So chemotherapeutic agents is a broader term which includes antibiotics plus synthetic compounds which are synthesized in the laboratory, which will also kill many microorganisms or suppress the growth of many microorganisms at very low concentration. Okay, so that's why the definition is here. So chemotherapeutic agents also destroys or prevents the growth of organisms, if you observe here, at low concentration, but may or may not be derived from microorganisms. This is the difference. Okay, so chemotherapeutic agents means both natural from microorganisms, synthetic from laboratory. So that's why you can't say, when I use a word chemotherapeutic agent, you can't say that chemotherapeutic agents are antibiotics. Okay, because it may be derived from microorganism or it may be derived from laboratory. Okay, that's why So chemotherapeutic agents also destroys or prevents the growth of microorganisms at very low concentrations, okay, but may or may not be derived from microorganisms, So that is the difference. Okay, antibiotic means mainly from microorganisms. They are obtained from microorganisms. Chemotherapeutic agents means may be obtained from microorganisms or may be prepared in the laboratory. Okay, both. So that's why we can say, yeah, first we can say all antibiotics are chemotherapeutic agents. I think you agree. All antibiotics, they comes under chemotherapeutic agents. Okay, because chemotherapeutic agents means both natural and synthetic. That's why all antibiotics, they are natural, they comes under chemotherapeutic agents. Thus, all antibiotics are considered as chemotherapeutic agents, but all chemotherapeutic agents need not to be antibiotics. Got it? So all antibiotics can be called as chemotherapeutic agents, but all chemotherapeutic agents, you need not to be antibiotic. Okay, because certain chemotherapeutic agents, I think, yeah, there is a quite examples have been quoted here. I think you please observe in this box. Okay, so you have sulfonamides here. Sorry, yeah, sulfonamides, isoniazid. I will write here. That's better. You have, there is a problem with pointer. You have sulfonamides, Namites, sulfa drugs, DES. This is D, DES, sulfonamides. I. Sulfonamides, you have INH, isoniazid. This is ISO, niazid, NIAZID, isoniazid. Okay. So sulfonamides, isoniazid, metronidazole, which is an well-known antiprotozoal drug. So they are synthetic. They are prepared from laboratory. That's why they are chemotherapeutic agents. So the bottom line is very simple. Chemotherapeutic agent is a broader term which includes antibiotics plus synthetic compounds. As antibiotics comes under chemotherapeutic agents, you can call all antibiotics as chemotherapeutic agents. There is no problem. But you can't say that all chemotherapeutic agents are antibiotics, because chemotherapeutic agents include both natural and synthetic. That's why, so you can't call all chemotherapeutic agents as antibiotics. Got it? So that's it. So that is the branches of chemotherapy: antibiotics and chemotherapeutic agents. Okay, and nowadays we are using some different term here. Let me also quote it here. So antimicrobial agents. Okay, we are using the term antimicrobial agents. It's the same thing. So includes both synthetic and naturally obtained drugs. Antimicrobial instead of chemotherapeutic agents. Nowadays we are using the term antimicrobial agents, which includes both natural and synthetic. Okay. So now the word chemotherapy. The word chemotherapy here, it was coined by a scientist, Paul Ehrlich. Paul Ehrlich is a scientist who coined chemotherapy, who coined or who designed the word chemotherapy, and he is called father of modern chemotherapy. He is called father of modern chemotherapy. Okay, if in any objective questions, if it comes, who is the father of modern chemotherapy, then your answer should be Paul Ehrlich. Paul Ehrlich is the father of modern chemotherapy. And he has given a term that is called chemotherapeutic index, that is margin of safety. You can see here. He has given the term chemotherapeutic index or margin of safety. This is margin of safety. And what is this chemotherapeutic index or margin of safety? You just observe the definition. It is the ratio of maximal dose which can be tolerated by the host. Means maximum dose of an antibiotic which can be tolerated by the host to the minimum dose which kills or inhibits the growth of the parasite. Got it? Means when I take an antibiotic, for example, the dose of antibiotic should be maximum for me. For me to tolerate the antibiotic, the dose should be highest dose. Okay. that can be tolerated by me. And the dose to kill the microorganism, it should be very, very low. Means my cell and parasite cell. For example, if I take if I take an injection of penicillin, it come across my cell and bacterial cell. For my cell, the dose of penicillin should be maximum so that I can tolerate. And for bacterial cell, the dose of antibiotic should be minimum. It should be minimum. Okay, the minimum dose which is going to kill or inhibits the growth of the parasite. Okay, so that is called as margin of safety or chemotherapeutic index. Okay, so antibiotic for a parasite or for a microorganism, the dose should be very minimum at which it will kill or inhibit the growth of microorganism, and the dose for host or human cell, it should be maximum so that the host can tolerate the dose. Okay, so that is called as chemotherapeutic index or margin of safety. Okay, got it. So that is about certain definitions, very, very important definitions related to chemotherapy. So we discussed what is chemotherapy, we discussed what is antibiotic, we discussed what is chemotherapeutic agent, we also discussed what is antimicrobial agent, and we also discussed about Paul Ehrlich, who is called as father of modern chemotherapy. And he designed a term that is called chemotherapeutic index, which we also discussed. Okay, so now let me discuss further. So first, before discussing, before moving to individual categories of antibiotics, first we should understand general principles of chemotherapy. This is very, very important. Means while prescribing an antibiotic to a patient, because you people are interacting with patients and all, and definitely antibiotics will be circulated more among the patients. So when you prescribe an antibiotic, what are the points that you should keep in the mind while selecting the antibiotic? So that comes under general principles of chemotherapy. That is, you can see here, if it is, I think it is quite visible, general principles of chemotherapy, and here you can see selection of antimicrobial agents. So how antimicrobial agents are selected. There are few points, let me discuss one by one. First one is clinical evaluation of probable etiology. This is very, very important. Clinical evaluation of probable etiology. Okay, means you have to find out the, I mean to say that what kind of infection the patient is having. Okay, so once you find out what kind of infection the patient is suffering with, okay, then you can prescribe a particular antibiotic according to the infection. Am I right? Okay, so here you can see clinical evaluation of probable etiology, means you should know the cause of the infection. Okay, for example, let me quote an example here. Suppose a person is having common cold. Okay, and you know that most of the cases of common cold are due to viruses. It may be due to viral infection. But thinking that the common cold may be due to bacterial infection, if you prescribe antibiotic, definitely antibiotics will not act on virus. Antibiotics are very effective on bacteria. Okay, so so in such circumstances, the use of antibiotics is not justified. Am I right? So first you should know what is the cause of illness. Okay, so once you decide that the cause of illness is a bacteria, then you have to prescribe antibiotics. Okay, but this, whatever I am discussing, this is only restricted to books and teaching. Okay, so nowadays what we are observing is very evident. So when you go to a doctor will blindly give you a broad spectrum antibiotic. Okay, I think you have come across augmentin, or what is that? Co-amoxiclav. That is amoxicillin plus clavulanic acid, higher antibiotic, so that any one of the bacteria which is responsible for your infection, definitely it will be killed. When it is going to kill many bacteria, definitely the illness causing bacteria may be maybe among that bacteria. Okay, so that is what the problem is. So it's like if a terrorist is hidden in some area, instead of catching hold the terrorist and shooting the terrorist, you are dropping bombs through a plane, and you are demolishing the entire area. Okay, so that the terrorist will die, and along with that innocent people will also die. So that is what happening with antibiotics, with the utilization of antibiotics, because there are many microorganisms which are friendly to us. I think intestinal flora is very friendly. That will keep your GIT healthy. So by using broad spectrum antibiotics, you are killing the unnecessary one, and you are getting cured immediately. But the problem is you are also going to kill your friendly bacteria, and you are going to reduce your immune system. You are going to weaken your immune system. So that is what happening with the use of antibiotics right now. Okay, so let me discuss first point. Clinical evaluation of the probable etiology is very important. You should know what kind of infection or illness the patient is suffering from, and whether the antibiotic is effective in that infection or not. You should know. Am I right? As an example, which is quoted here, okay, you can just read this paragraph. In many cases of fever, such as due to common cold, are due to viruses, okay, are due to viruses which are not susceptible to antibiotics. Okay, if an infection or a fever is due to virus, and if you give antibiotic, then virus will not die due to antibiotic. Okay, so as the season changes, virus will go away. You will become healthy. Okay, but that antibiotic what you used is unnecessary, and it will cause a lot of trouble. That's why the use of antibiotic in these cases where the causative organism is quite different, okay, so there it is not justified. It is not justified. That is called as clinical evaluation of probable etiology. Okay, first point. Second point is identification of causative microorganism. This is also very important. For example, if I find out the causative organism is a bacteria, you should know what is the type of bacteria, whether it is a gram positive bacteria, gram negative bacteria, acid fast bacteria, whether it is a spirochete. You should have a knowledge. Okay, so for example, if the bacteria is a gram negative bacteria, okay, and you are using penicillin without proper knowing the type of bacteria, you are using penicillin which is only effective on gram positive, which is not effective on gram negative. Can you justify the use of penicillin? No. Okay, so penicillin is ineffective on gram negative bacteria. Gram negative bacteria will not die. Okay, unnecessarily you are using penicillin, and you are exposed to side effects of penicillin. So that is the problem. That's why once you identify the causative organism, please try to identify what is its nature, what is its subcategory, whether it is positive, negative, acid fast. You should identify, and based on that, you should start your treatment. You should start the treatment. Okay, got it? So that is the second point. Third point is age of the patient. This is also very important. Am I right? So because there are many antibiotics that are very dangerous in neonates, and several antibiotics are very dangerous in elderly. Okay, let me quote an example. Suppose an elderly patient is having kidney related problem. He is having glomerulonephritis. Okay, and if you use an antibiotic which is an aminoglycoside, if you use aminoglycoside antibiotics like streptomycin or amikacin or neomycin, which are very nephrotoxic, which will have a dangerous effect on the kidney, which will damage the kidney, does your use of antibiotic is justified? No, you should not use aminoglycoside antibiotics in elderly patients. That's why age is also very important. And coming to neonates, see, I think you know about this antibiotic. This is a well-known antibiotic to everyone, that is called chloramphenicol. Chloramphenicol. Phenicol. Chloramphenicol. So chloramphenicol is a well-known antibiotic, but in neonates, it causes a problem that is called gray baby syndrome. Okay, the problem is chloramphenicol is metabolized in the liver, And chloramphenicol requires certain enzyme system for its metabolism, and that enzyme system is glucuronide conjugation, or I will write it as glucuronidation. 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 D-A-C-I-O-N. Glucuronidation. Okay. Yeah. So the problem is in elderly individuals, adults, definitely. In adults, the glucuronide conjugation is well developed. That's why we don't have any problem with chloramphenicol. But in infants, this glucuronide pathway or glucuronide metabolic system is not fully developed. In neonates especially. Okay, 1 year or 2 years baby. So it is not fully developed. And if you give chloramphenicol, definitely chloramphenicol is not metabolized adequately, okay, or sufficiently in neonates because of incomplete availability of glucuronide enzymes or incomplete development of glucuronide metabolic pathway. So chloramphenicol will not be metabolized properly, and automatically that chloramphenicol will causes lot of problem. It causes abdominal distension. It causes greenish color of skin and greenish color of stools. Okay, it causes respiratory related symptoms, and that is called as gray baby syndrome, which is a well-known problem with chloramphenicol. So that's why age is also very important. Got it? So that's why certain drugs should be avoided in elderly, certain drugs should be avoided in neonates. Like aminoglycosides should be given with utmost care in elderly patients who have renal problems, and chloramphenicol should be given at a very low dose in neonates because the metabolic pathway for chloramphenicol, which is glucuronide conjugation, is not fully developed in neonates. Okay, so that is the third point, age of the patient. Fourth point, let me also discuss, that is called pregnancy and neonatal period. This is also very important. So you should select such an antibiotic which have which are very safe in pregnancy, because many antibiotics or antimicrobial agents can cross the placenta and reach therapeutic concentration in fetal tissues, all right, which can damage the fetus. Okay, and if an antibiotic is very necessary in pregnancy, then you have to use these antibiotics which are very safer. For example, penicillin is a safer antibiotic. You can use cephalosporins, you can use erythromycin, you can use lincomycin and sulfonamides. So these antibiotics can be used. Okay, don't use tetracycline, don't use fluoroquinolone, don't use metronidazole. Okay, so don't use those antibiotics because they are very dangerous to the fetus. That's why selection of antibiotics in pregnancy and neonatal period is very important. Okay, so try to avoid the antibiotics. If antibiotics becomes very essential, then you can use penicillins, cephalosporins, erythromycin, lincomycin and sulfonamides. That's it. Okay, and fifth point, let me also discuss, that is severity of the disease. This is also very important. Okay, based on the severity, you have to instill the use of antibiotics. Suppose if a person is suffering from bacillary dysentery, ordinary dysentery, which is caused by some bacilli, okay, some streptococcus or staphylococcus induced dysentery. Okay, so now in case of bacillary dysentery, if oral rehydration salt or ORS is sufficient, with ORS, if the bacillary dysentery is going to be end, or whatever the dysentery that has been, whatever the loss of electrolytes that has occurred due to dysentery, if they are restored with ORS and the dysentery is not that much severe, it is going to stop after few hours, then there is no need to go for antibiotic. Okay, so first you have to restore the electrolyte loss. Whatever the, I mean to say that whatever the electrolytes that have been lost during this dysentery or diarrheal episode, that has to be restored. And once if you restore that, if your dysentery is going to stop, then no need to go for antibiotic. ORS is sufficient. Oral rehydration salt is sufficient. But in severe cases, if the dysentery is very severe, then you can go for drugs like cotrimoxazole. Here I have shown you. Okay, you can use cotrimoxazole. Sorry, yeah, cotrimoxazole, ampicillin, and fluoroquinolones. So you can use these three drugs. One is cotrimoxazole, one is ampicillin, and fluoroquinolone. Cotrimoxazole is a combination of sulfamethoxazole and trimethoprim that I will discuss. Ampicillin is a derivative of penicillin. Okay, that is, it is an extended spectrum penicillin, and fluoroquinolones are antibiotics which are DNA gyrase inhibitors. Means they examples are ciprofloxacin, or you can say ciprofloxacin derivatives. Ciprofloxacin, sparfloxacin, levofloxacin, payfloxacin, amifloxacin, gatifloxacin. So all those drugs are fluoroquinolones. Okay. Yeah. Okay, students, I will stop now. So we will continue in the next session. So let me share this video and please go through. This is very important because antibiotics are routinely used and regularly used. I am reiterating this again. So antibiotics utilization is much more when compared to other drugs what we discussed. That's why you should have a thorough knowledge regarding the pharmacology of antibiotics. Okay. So watch the video. In case of any doubts, please raise your doubts. Let me know. Okay. So let me answer. Thank you. Thank you for listening.